Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College and principal investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL, and site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, January 30th, 2023. While COVID cases, hospitalizations, and deaths nationally are going down from the current XBB.1.5 Omicron subvariant, and people increasingly have abandoned prevention measures, there are still good reasons to get vaccinated and boosted. The first reason is for persons over 65 who have not been boosted, they're at continued high risk of hospitalizations and deaths. Persons over 65 now account for 88% of deaths due to COVID. So, for persons in this age range and those who have contact with them, need to get vaccinated to protect seniors from serious illness and death. Second, the extension of the current public health emergency declared by President Biden is not likely to be renewed after it expires in April of this year. When the public health emergency ends, so too will federal funding for COVID vaccines and treatment. Pfizer and Moderna both have indicated that the cost of getting a COVID vaccine will be about $170 per shot, while early treatment with Paxlovid will cost $530. So for persons who are not covered by insurance, the cost for getting vaccinated or treated will have to be paid out of pocket. Third, there was a new study published last week in the journal Neuron, which is based on data from FinGen, a nationwide Finnish biobank with genotyping data available for over 300,000 individuals, which were in turn replicated in data from over 500,000 persons from the UK biobank. The study found a strong association between persons who had previously had any one of 22 viruses, including flu, pneumonia, meningitis, and shingles, and a number of neurodegenerative diseases, including dementia, Alzheimer's, Parkinson's disease, and multiple sclerosis, up to 15 years after viral infection. While the coronavirus was not included in the study, results suggest that persons who experience neurological symptoms as a result of COVID would appear to be at increased risk for developing neurodegenerative diseases such as Alzheimer's. While study results were associational and will need further replication, they provide evidence for a previously unrecognized added benefit of getting vaccinated against COVID. Nationally, hospitalizations and reported cases are decreasing in all but a few states and territories. At the national level, both figures are down by around 25% over the past 2 weeks. Deaths have not seen the same improvement, however. The average number of deaths announced each day for most of January has remained at or above 500, a troubling high figure that is about double the number of daily deaths typically seen in a bad flu season. In addition, test positivity rate remains high at 19%, suggesting that the number of cases is much higher than those reported. Tennessee continues to lead all states in the nation in the number of reported cases of COVID-19, almost double the next state. Over the past 2 weeks, the number of reported cases in Tennessee has increased by 104% to 3,475 per day, or 51 per 100,000 of the population. Hospitalizations in Tennessee, meanwhile, were down over the past 2 weeks by 19% to 718 per day, while the average number of COVID-related deaths was 11.6 per 100,000 of the population. Test positivity during the past 2 weeks in Tennessee was at 0.18, just slightly below the national average. The number of reported cases are deeply troubling, as they are a leading indicator for hospitalizations and deaths with about a 2-week lag. There are now 4 counties in Tennessee in the CDC's red zone for community level of COVID transmission. Tennessee counties in the red zone include Washington, Unicoi, Carter, and Claiborne counties, all in the far northeastern region of the state. There are an additional 18 counties in the yellow zone. 10 of the counties are in northwest Tennessee, 2 counties are in the south central part of the state, and 6 counties are in northeast Tennessee. People who live in counties that are in the red zone should still be cautious and wear masks in crowded indoor spaces, social distance, and increase ventilation where possible. Only 33% of the population in the United States has received a COVID bivalent booster, suggesting that COVID will continue to spread for the indefinite future. People who are not currently vaccinated and boosted still need to consider the pros and cons about getting vaccinated and/or boosted. Their decision about getting boosted should now take into consideration possible protection against development of a neurodegenerative disease such as Alzheimer's or dementia. So until next week, please protect yourself, loved ones, friends, and colleagues. Get boosted, wear a mask in public or indoor spaces where indicated, and provide good ventilation where possible. For now, this is Dr. Paul Juarez from Tennessee SEAL and HealthWorks, wishing you a wonderful week. Thank you. Be safe.